Okay. So we're going to start with introductions. I will introduce myself first. My name is Linda Dickman. I am one of the regional training consultants here at the OIC, one of the SHIBA counselors. I have been with SHIBA since last August. That's when I took on the RTC role for basically Southwest Washington, well, the coastline. So up to from Collier County, clear down to Skamania, I think, or Klickitat, whichever one is the furthest east that I have over there. I go through Mason, Thurston, Lewis, and down. Before coming over to SHIBA, I worked as one of the analysts over in the life and disability unit, worked with health insurance complaints, and prior to that, I was a claims adjuster for many years at one of the large insurance companies. So that's a little bit about me. I'll go ahead and have the other RTCs introduce themselves, and then we'll let you all introduce yourselves. So Noreen, do you want to go ahead next?
Sure. I'm Noreen Bryson. I'm the RTC in Spokane. So if you are here with AltQ, you might see me at some of the trainings and things like that. And for right now, I cover the counties that are east of the Cascades. That's going to be changing pretty soon, but I cover all of central and eastern Washington, supporting the sponsors in those regions and the volunteer training for that. I've been with SHIBA. I'm coming up on about 3 years with Washington SHIBA. I was with Idaho SHIBA for about 10 years before this. So I've been doing the Medicare for a while and training volunteers to help with this for about 8 years now. So hopefully we can help you. We can get you guys all set and ready.
Great. Shannon?
Hi, everyone. My name is Shannon Sky, and I am another regional training consultant. I work with Whatcom County, Skagit, Snohomish, Kitsap County, Island County, and San Juan County. So kind of those northern counties, this side of the Cascades. And I've been here since last July. And so I am new. I am learning still. Before this, I spent about 15 years with working with AmeriCorps programs and training volunteers with AmeriCorps and Senior Corps programs. So have worked with a lot of really great volunteers, and I'm really excited that you're joining us with SHIBA. SHIBA is a great program. It's so needed, and you will find that you are really, helping people with health insurance, which is, for a senior, especially one of the most important aspects of their reality. So welcome, and I look forward to getting to know you more.
Thank you. We do have Rosie. She's not here yet, but she'll introduce herself later when she does arrive. Do we have any volunteer coordinators here? I think I heard Pam earlier, but I think she left.
Yes, Pam left.
Okay, all right. If there aren't any volunteer coordinators here to say hello, then if the volunteers, if you would like to say hello, if you'd give us your name, maybe where you volunteer with, which group, who is your volunteer coordinator, or which group do you belong with, and maybe what motivated you for being a SHIBA volunteer. And if I could get someone to just jump in and start off, that'd be great. Otherwise, I will call on you.
I'll start because you can't see me anyway.
Okay.
So I'm with Pam Monahan and up in Clark County. I just started, but I learned about this program actually through friends in Hawaii.
Oh, wow.
So they recommended, they volunteer in the program in Hawaii, and they recommended that they thought it was a good fit for me. So I came out and met Pam, and she was so devoted and enthusiastic and compassionate and everything you would just, she's so ideal in so many ways that I felt like I had to. This was like the perfect, it was really a good fit. I feel like it's a good fit. So I'm starting, I mean, we're still very busy, but I'm starting the process. So hopefully this will be a long-term volunteer relationship.
Well, that's wonderful, Jerry. Welcome. We're glad you're here. Pam is a volunteer coordinator. I'm the RTC for your area, so you'll see me going forward. I'll do most of your monthly CEs, that type of thing. So welcome.
Okay, thank you.
Yeah. Okay, next.
I'm Don McClaskey. Looks like I beat you to it, Jim. I like to give back if I can, and I think this is a good way. I'm familiar with Medicare, having gone through it myself. A friend of mine is a volunteer in Skagit County, which I believe that's where I'll be. That's it.
Well, that's great, Don. So you're in Skagit County, so you must work with Celeste,
Yes, yeah, she's been
Okay.
my contact.
the volunteer coordinator, great. And then you'll work with, so Shannon is the RTC for that area now. And it was mine, but we just kind of doing some realigning, so she's taking over.
Okay,
So
great.
you'll see us both, but Shannon will be your point of contact. So, all right, Jim, did you want to go?
Okay, so I'm Jim Itamura. You'll never remember that, but I'm actually from Hawaii. So like, wow, that's why I wanted to jump in next. But I didn't hear about it from my friends in Hawaii. I got the little mailer, and I thought, oh, that sounds like it could be fun and helpful, and I could learn some stuff too. So it's me.
You're very helpful.
Oh, and I'm in Vancouver.
Vancouver. Okay, so you're with Pam as well?
Yes.
Yes. Okay. Well, nice to have you here, Jim. Thank you. Okay.
Hi. Oh, I'm
Go
sorry.
ahead. Go ahead.
Okay. Hi. I'm sorry I interrupted you. I am Norma Summer. I live in Kitsap. I was the executive director for long-term care for 47 years. I retired almost 18 months ago and was looking for a way to help and to continue to serve and to have purpose through retirement. A colleague from Olympia was a SHIBA volunteer years ago. And so I was somewhat familiar with it to start with.
Well, we certainly need you. Thanks, Norma. You'll be a great resource for us as well. Okay, Sharon, you're up.
Sharon Hogan. I live in Vancouver, so I work with Pam. I've been retired about 2 years, and I've been looking for a volunteer activity that felt like it was a good fit. And a friend of mine told me about SHIBA. And so, yeah, it just seems like it's a great way to help people, but also get some intellectual stimulation at the same time. So that's why I decided to get involved.
Simulation, absolutely. So we're glad to have you. Thank you, Sharon.
Thank you.
Hi, my name is Un Lee. I wish I retired, but I still have full-time job. but the reason I volunteer with Shiva is I used to be volunteer coordinator a long time ago, like 15 years ago. We are military family, so we kind of moved around. So between 2000 maybe 8 9 10-ish, that time before we moved to Georgia, I used to work with the Korean Women's Association at the time, and then I was a volunteer coordinator for the SHIBA program. And then at that time, I knew it is really good program. It's helping, consumers. So, so I think I still have a little knowledge about that. I wish I didn't forget too much. So, I wish I can be, little, I can contribute for the community for the, especially for, I'm the Korean native speaker. So if I can, serve for that, people, or not just limited that people, but the other seniors too. So, that's why I'm, apply for. Yeah. Thank you.
No, that's wonderful. So where are you at now?
Oh, yeah, forgot. Yeah. I live in the Pierce County, and then my
Okay,
volunteer
so
coordinator.
so your contact is Tammy then? Is
Yeah,
that
yeah.
right? Tammy Wheeler?
Yeah, Tammy Wheeler. Yeah, yeah. I contact
Okay,
with
so
Tammy, and then we did. Yeah.
maybe it was me that froze.
Oh, really?
Uh-oh.
Okay. Yeah, Tammy.
Yeah, we're hearing you, but you're not moving, Linda. So you might be getting ready to leave us for a second.
Okay. Yeah.
That happens sometimes, you guys. So if we drop off, don't worry, we'll be back.
Okay.
And if you drop off, you'll probably just automatically reboot too, but just come back in.
Well, if it's okay if I go ahead.
Absolutely, go ahead.
I'm Bonita York. Pam is my coordinator. I live in Southwest Washington. I guess I could say my jam has always been working with either children, and especially young children, or with elders. I kind of go one side or the other. I spent 3 years in Clark County in the 80s we had a Clark County crisis line that we could answer from home. So my children were young at that time, so I could do some volunteer work that felt really comfortable for me without disrupting my family life. I'm going to see how this goes. I have a couple of TBIs, and I don't know. I've challenged myself with puzzles enough that I've regained some brain power, but I'll just go through this with you all and see if this will work for me, if my memory will still serve me well. Good to see you all.
Thank you. Well, and Benita, you know what? We have other roles too. So I want everyone to remember, like, this is our first step. And for the person welcome back, Linda. For the person, I'm just going to talk for 1 second more. For the person who said, like, to keep learning. Yeah, you're going to keep learning. I mean, we learn something new several times a week at least, and having been doing this for a long time, right? So this is one of those things where remember that you're just getting a base. When it seems overwhelming, you're just getting your foundation. We're just laying the foundation here this week. And then it's going to build and build and build, but that's where we're starting. And we do have other things that there's other things that you can do, that if counseling isn't for you, you can take this knowledge and help people at fairs, like table at a fair, or things like that. There's other things that we need that our sponsors need help with. So it's not like, if you feel that counseling's not for you, don't worry, because there might still be opportunities if you still like the Medicare aspect of it, and the population that we're serving, because it is really valuable. All right, Linda, I'll give it back to you. Sorry. You step away and I take over, and that's it, right?
No, that's fine.
There she goes again.
No, I was like, well, this is fun. So anyway, I don't know. Did anybody else go after, is it Un? Do you say, how do you?
Yes, Un?
Un? Okay. And I was just asking, you're with Pierce County, so with Tammy,
Yes.
correct?
Yes.
Okay.
Yeah. Yeah.
Yep.
Okay. So you'll work
And
with
Benita went,
Benita went? Okay.
and
Thank you.
she's with ADSWA.
With ADSWA? Okay, so
Mhm.
you're one of mine as well. So nice to meet you. Okay. Who do
Can
we
I
have?
jump in?
Oh, go ahead,
Carol?
Carol.
Yes, sorry, before I start coughing, because I have a cold. My name is Carol. I'm probably going to be with you because Pam Monahan is my coordinator. And this is all new to me, so I'm looking forward to learning a lot. I was introduced to this because I had been a caregiver for my mom who recently passed away, and the hospice bereavement counselor recommended this program to just sort of, because I've been working with seniors in the past as well. So she just said this would be a really good fit for me. So I'm giving it a shot.
Oh, that's great. We're happy to have you.
Thanks.
Yeah. All right.
Okay, can I go?
Please.
Okay, so my name is Alex Birlaev, and I'm in Olympia, Thurston County. I work with Kelly Hudson. Okay, and well, I would like to learn more about Medicare. I'm new to it, and I also like to help people. So that's why I joined the program.
Well, that's great. And there's a lot to learn.
I know. I kind of started to learn it on my own, and it's like, wow.
Yes.
And then I started looking for help, and then I found this program, and I thought, well, why don't I learn and help other people, you know?
That could be how most of us got here.
Yes.
So, yeah, a lot to learn, but no, welcome. Kelly's part of one of my groups, so you'll be working with me as well.
Okay,
So
okay.
nice
And
to have
call me
you.
Alex.
Okay.
Call you Alex?
Yes.
Okay, perfect. Thank you. All right. Then Donna, it looks like you're ready.
Yeah. Oh, sorry. I don't know how to work this here. Anyway, okay, so my name is Donna Pickens, and I've been retired. I'm a retired nurse, so I thought this would be a good way to be a volunteer versus going out and doing physical things like planting trees. So, so, and it does sound like it's a little challenging for the brain. So that's good. Yeah. So, and I'm from Spokane County, and Monica is the leader there.
All right. So you'll be working with Noreen.
Yeah. Oh, yeah.
Yeah.
Right.
Yeah. And then who do we have left? I think Polly.
Yes, I'll jump in now. I'm Polly Oliver, and I'm here in Pierce County with Tammy Wheeler also. So that's where I'm going to be. I actually certified as a SHIBA counselor in North Carolina last summer. So I helped out a little bit during open enrollment last fall, but I haven't done much else beyond that. So anyway, it is very technical and challenging. So I like that part too. And I'm looking forward to doing more up here.
Well, that's wonderful. Thank you. We're glad to have you. Kendra, it looks like you've just joined. Do you want to say hello?
Hello. Hi. Sorry I'm late. I'm Kendra. I am the field supervisor with the SHIBA program, which really means that I am here to support the regional training consultants and then make sure that they have what they need to help support the volunteer coordinators with all of our SHIBA programs that sponsors, and then the volunteers. So basically, I'm the behind the scenes nuts and bolts person, and I'm so grateful to be able to work with the regional training consultants who are truly doing the work that needs to be done and giving these trainings. So thank you. And hi, I'm in Fircrest, and I apologize for being late. I was at a sound outreach event today, which is our sponsor in Pierce County.
Very good. And Benjamin, looks like I missed you. I'm sorry.
No worries. I'm Ben. I'm in Pierce County, so I'm also with Tammy Wheeler. And then I just graduated from UW with public health, and so I'm just looking for kind of like community outreach programs to help support.
And you said Ben? You go
Yeah.
by Ben?
Yeah.
Okay, very good. Okay, Noreen, did you have a question or something, or just?
No, I was just clapping for Ben and his new degree in public health. I think that's very brave to go into public health. I just admire that a lot.
Very good. All right. So I think we have everybody so far. Did I miss anybody? If I did, please jump in. I didn't mean to.
Well done.
All right. So I am going to get us going then, and whoops, get the, oh, no. There, I want to kick myself out again. I'll get us started with the introductions. Let's see. Okay. I think we've got it. The SHIBA Volunteer Advisors. Everybody seeing the screen? Somebody nod, yes? Seeing my slide? Okay. All right. So what is a SHIBA advisor and what do they do? So we provide guidance, answer questions, explain options, and make sure people understand their rights. We can help them with the pros and cons of their Medicare decisions, but at the end of the day, the client decides what is their best option. So different people, everybody's situation is different. We just want to provide people with the options so they understand what's available to them, and they can decide what's going to work for them. So we're unbiased, we're neutral. We just want to help them understand. Okay. A day in the life. So our work is centered on volunteers. We're neighbors helping neighbors and peers helping peers. You'll get all kinds of questions. Some are questions that we'll know answers to. Some are things we won't. You'd be surprised what people will ask. We'll give you resources. Some of the questions are going to be within the scope of things that we can handle. Others we don't, but we do hope that you can help people or refer them, perhaps to where they can go and where maybe they need to go for the information for the questions that they do have. Our expectations are really just for you to, be kind, be courteous, be empathetic, and then, help people with the resources that are available to us. Okay, so Medicare is diverse. Today, we're going to start with an overview of the Medicare program, what it takes to get started in Medicare. We'll talk about eligibility and enrollment, what some of the covered benefits and the costs are for Part A and Part B. And then we will talk about, let's see, I think if we get through all of those today, we've got this spread out over 3 days now instead of 2, and I want to make sure. Yep, tomorrow we'll talk about Part D, Medicare Advantage plans, and then on day 3 we'll talk about Medigaps, financial assistance for people with low incomes, and then just kind of do an overall review. Okay. Sure, I had the right information for us this time. The personas. So as we focus today, we're going to focus primarily, this is basic training. We want to talk about people who are eligible for Medicare at age 65. So they're using their initial enrollment period to enroll in like Medicare Part A and Part B, getting a Part D plan or a supplement, and Medicare Advantage. So we're looking at just your average turning 65 and getting ready to retire individual. We do have a list in your workbook on page 2 for the rules of engagement if you want to review that information. We do want this to be a good quality learning experience, so we have limited this today to just your basic scenarios, okay? There are other options, other plans. We'll talk about those at other times, kind of more the employee retiree plans, you know, other situations that apply to people, but we're going to just basically focus on the commercial market and our individual turning 65. And that's what I've got. So from here, I think I'll turn it over to Noreen to go through the overview of Medicare. And then again, I have another course. I have a continuing education course for the ADSWA group. So I'm going to leave for that, but I will be back. So I leave you in good hands, everyone. Oh, I'm trying to get rid of my share screen, Noreen. Did you take over?
No, it's mine, Linda. I just took it over.
All right, very good.
I ripped it out of your hands.
All right.
So before we go any further, I wanted to just take a minute to do a little bit more housekeeping. As we go through today, you're welcome to either raise your hand to ask questions, then as Linda explained, we'll stop, or you can use I opened the Q&A, and that's a great place to ask questions about the material. So you can see that by going to your 3 dots. If it's not already showing as a selection, again, the 3 dots at the bottom right-hand side of your command bar in the circle, you should see Q&A, and that will open. Right now, it doesn't have anything in there, but you'll be able to see that or you'll be able to post a question in there once we get going. So if you'd like to do that, you can use that or the chat, take your pick. It's a little bit easier for us to manage if you use the Q&A. It's also easier for us to manage the answers later to make sure that we have a record of them so that we can improve our training. All right, enough about that. Let's move forward. All right. So we're going to do an overview of Medicare. And this is about, there's 4 parts of Medicare. There's 2 systems for it and 3 markets. All of our programs are structured similarly as we go through this training. At the beginning, we're going to describe the outcomes for the section, and then we'll discuss them in the context of the counseling and skills and abilities. So as we go through here, we're going to have some outcomes that we're looking for, or some objectives. Our knowledge objectives for this section are how we're hoping that you'll have 3 key takeaways. The first is that Medicare has 4 parts. The second is that there's 2 systems of care, or 2 ways to have Medicare coverage. And the third is that people enroll through one of 3 different insurance markets. Okay. We also hope that you're going to you'll be able to recognize at least a few of the reasons why this matters and how it will help you be a successful SHIBA volunteer advisor. For the skills and abilities outcome, we're hoping that you'll be able to identify your own insurance if you're a Medicare beneficiary. The 4 parts of Medicare, the 2 systems or paths of Medicare. You'll hear me say that both ways because it kind of depends on the materials you're looking at as to how they're referred to. So I like to use both. The 3 markets for purchasing the plans that are not the government issue plans, and how we as Medicare counselors help clients understand their needs, their rights, their protections, and their options based on the story that they tell you while you're helping them. So we So we have our clients tell us their situations, right? And our job is to kind of decipher that. And we're hoping that you'll be able to see how you might be able to help them as you go through these. So there's two paths or systems for care for Medicare benefits. The first is original Medicare, and the second is Medicare Advantage. This is also known as Medicare Part C, or in Medicare materials, CMS materials, you'll see them referred to as Medicare Health Plans, okay? Each beneficiary chooses how to get their Medicare coverage. They might do original Medicare, the one on the left, or they're using Part A and Part B, government issue. This is standard government issue. It's when you first sign up for Medicare, you get the coverage, and that's what you're keeping, okay? And then they can add Medicare Part D coverage or supplemental coverage called Medigap plans, or there might be other supplemental coverage that's offered through retirement plans or things like that that will help pay back up. TRICARE for Life is an example of that for people who are retired from the military. Then there's Medicare Advantage, and everything is combined in one plan that's purchased from one insurance company. It's a plan that's purchased from an insurance company, just like your healthcare that you probably had from employment, right? We have Kaiser, we have United Healthcare, we have and it's an HMO or PPO. These Medicare Advantage are that managed care plan that's just like that. Okay. So on kind of just a different way to look at that, we have Medicare at the center of it, and the organization for that is CMS, the Centers for Medicare and Medicaid Services. And we use the name Medicare for that. You can either have your benefits directly through them, that you have your medical in your hospital. This is Part A, this is Part B, and then we have a separate Part D plan that we're buying a plan from a company to get the drug coverage. The other option is to have a Medicare Advantage plan. And with that plan, we have the plan that we're buying from the company, and we have the hospital medical and prescription drug coverage through that plan. Medicare is major medical insurance. It does not cover all the medically necessary or all medically needed services. There are some services that are not covered. It also does not pay 100% for all covered services. People have cost sharing involved, okay? Medicare generally has a deductible, and then once the deductible is paid, that's either an annual deductible for Part B, I think it's $254 or something like that this year. Or maybe, I don't know, we'll figure that out when we get to A and B. There's an annual deductible. And then we have co-insurance for Medicare for the most part. For original Medicare, it's generally 20%. Medicare will pay 80%. And then a person with Medicare has to pay 20% co-insurance. Or there may be co-pays for some procedures. And co-pays are very, very common with Medicare Advantage plans. Some things are not covered by original Medicare. And when we're talking about original Medicare, we're talking about standard government issue Part A and Part B, okay? That you're getting when you first sign up. And those are the benefits that are included in Medicare Advantage plans as well. What's not covered is prescription drugs. That's why we have Part D drug coverage. It was added in 2007. Eye exams, hearing aids, and dental care were excluded from Medicare when it started in 1965, and it's still excluded, okay? And then some therapies like acupuncture, chiropractic, massage, naturopathy, those are either excluded or limited to very specific uses. Like acupuncture can be used for some neck and back pain relief, and chiropractic as well. They might be approved for very specific uses, but not for any medical therapeutic use. Okay. Most people in Medicare have coverage in addition to Medicare. More than 90% of people on Medicare have insurance in addition to Medicare, either through a Part D plan or employer-related insurance. That's really common. Medicaid benefits, people have Medicare through that is supported by Medicaid benefits. Some people buy a Medigap plan to help. I mentioned those co-pays and co-insurance. And there's other plans. Oops, I'm so sorry. I went the wrong way. So more than 90% of the beneficiaries elect other insurance in addition to their Medicare Part A and B that they're getting from the government or their entitlement, as noted on this slide. These aren't exclusive categories, and we're talking about 90% of the beneficiaries having that. There's overlap. You know, half of the employment-related coverage is Medicare Advantage plans. Okay, but half of Medicaid coverage is in Medicare Advantage plans. And the total of all the people on Medicare, about half of them in both the US and in Washington, just a little bit over half, are in Medicare Advantage plans. So there's a lot of overlap there, but the point is that most people do have additional coverage. Okay. So we have the two systems for Medicare benefits. You choose to get the entitlement. Sorry, I'm having a little bit of a hard time with that word. Part A and Part B, as well as other insurance in one of the two systems. They're mutually exclusive, okay? So you can't get a Medicare Advantage plan and then get to the Part D part and say, oh, I want a separate Part D plan. No, there are Medicare Advantage plans without Part D coverage, without drug coverage, prescription drug coverage. But if you get one of those, you can't have Medicare prescription drug coverage. You can't come over here and get that Part D plan. You have to get it through this or have it through what's called creditable coverage, which would be something like VA coverage or something like that. We talk about that more when we get to Part D coverage. Okay. So we start with original Medicare, and then you add the plans onto it. The coverage that's in addition to original Medicare, you can get through employer group insurance plans. Some people keep working and they don't need to come on Medicare right away. So they may only get Part A and then be insured by employer group plan, either their own or their spouses. There's also what we call commercial market insurance. And that's what we help people with, is Medicare Advantage plans and Medicare Part D plans and Medicare supplement plans. We help them understand those, and we might even help them enroll in an Advantage plan or a Part D plan. But they're a commercial market that's available to anyone, okay? The employer plans are offered through an employer or a union or something. It's directly related to the person's employment or their spouses. But the commercial market plans are available to anyone. And then there's Medicaid that covers people on Medicare as well. And Medicare plays primary for people on Medicaid, but there are what's called full benefit programs and partial benefit programs that help people pay Medicare costs, or they might give them access to special plans that will reduce their cost as part of their Medicaid benefit. One of our jobs as counselors is to learn to ask the questions that are needed to get a clear picture of the client's situations and options. That's one of the primary things that we do. We ask the questions to help unravel where they're coming from so we can help them with where they can go to best use their needs. Okay. So for those of you in Medicare, let's have you think about which parts of Medicare you have now and whether you have original Medicare or Medicare Advantage. And if anyone's interested in sharing, please feel free. We'd love to kind of have, you know, some open examples. Which market did you come in from? The commercial market, meaning the public market open to everyone, an employer group health plan as a retiree, or through Medicaid through the state? And are you receiving any financial assistance for Medicare costs? So if you'd like to share any of that or all of that, please feel free to either in the chat or just raise your hand. Otherwise, I can give you an example. Don.
Well, I am on the original Medicare.
Oops, you muted yourself.
Thought I unmuted myself. I'm sorry.
That's okay.
I'm on original Medicare. I've got a Part G
Medigap.
supplement plan and
Mhm.
also Part D.
Yeah.
And no, I'm not getting any assistance.
All right, so you're on that original Medicare path that we
Yes.
talked about back here. You're on this side. You have original A and B, use your red, white, and blue card, and then have the Part D plan. That's a separate plan from a company and a Medigap plan.
Yes.
Awesome. Anyone else want to share? So I'll share one of the things that's happened. My mom used to be just like you. My mom's 91 now, and she had Part A and B, and then she had Part D and a J plan, which was an old plan that had prescription drug coverage with it. And when she turned 80, 11 years ago, and it went up to over $300 a month, and she stopped traveling and being a bird, she switched over to a Medicare Advantage plan. So everything's all in one plan now. Karen. Welcome.
Oh, hi. I have Medicare Advantage. And so I'm got Part A, B. I don't know if I've got D, although I don't pay for my drugs. They're zero.
So then you probably do.
Okay. And so I think that obviously puts me in the commercial market.
Yep. Yeah, if you picked it from all the plans that are available, if you didn't get it through an employer or through Medicaid benefits, then that's the commercial market. And that's how most people join. Okay. So do we have any question about the two ways that people have Medicare, those two systems? Or the different markets, the different ways people get into those plans? And that's good that the markets will become a little clear. The commercial market will become clear when we go into the Medicare Plan Finder at the end of the day tomorrow and Thursday, if we have time. We'll go in there and we'll look at those plans that you guys actually help people understand and make decisions about. Okay. Whoops, I think I went too far. All right. So some of the things that we consider when we're considering those markets is who makes the rules about eligibility. The people who are getting employer plans, the employer makes the rules. The employer plan makes the rules about the eligibility, right? It's that group that they're serving, like they were Boeing retirees or they're state employees or things like that. Also, who determines the enrollment timelines? And that is generally CMS because it's open enrollment, October 15th to December 7th for the general public. But that's different for people who are like PEB retires. That's the Public Employment Benefits Board, state employees and school teachers and retired, and some of the other retired public servants are in PEB, and they have their enrollment period might be like November 7th to November 30th. Those individual groups that are doing that for the employee plans, they can have different timelines for enrollment. Okay. And if you miss it, you miss it. Who holds the contracts with the providers is one of the things. We're not going to talk about that very much. But in a very general sense, on the people on original Medicare, you're using that red, white, and blue government issue Medicare card to get your services at the doctor. So Medicare holds the contract with the providers. And with Medicare Advantage plan, you're getting that plan. United Healthcare or someone or another company, Kaiser, is contracting with CMS, with Medicare, and they are managing the A and B. So you no longer bring your red, white, and blue card to the doctor's office. You're using your card for that insurance. The provider of the insurance is doing the contract. So does that make sense to everyone? That on original Medicare, it's Medicare, right? That's paying and determining the benefits, and that's what you're using. But on Medicare Advantage, everything is with that private plan. Okay. And then same, Medicare sets the benefits and makes the rates for cost sharing. That's how hard, that's like a mouthful, isn't it? Setting the benefits by that, what we mean is what's approved and what's not approved for services. What can you get and what can't you get? And making the rates for cost sharing, that's who, like the amounts of the co-pays or the co-insurance, okay? Because the Medicare, as I said, mostly has 20% co-insurance after you pay a deductible for the most part on original Medicare. And that's why people like Don have those supplement plans, because we'll talk about that tomorrow or Thursday. But the Medigap plans help fill in those gaps for what Medicare doesn't pay. And that's cost sharing. Cost sharing is the cost that you have to pay, that the consumer has to pay, that the client has to pay. All right. On the Medicare Advantage plans, it's mostly copays, and that is, those rates are set by that company and what they'll cover. Now, Medicare, just one note, and almost everything you're hearing from me, you're going to hear in more detail in future sessions, but that those A and B services that are on Medicare Advantage plan have to be at least as good or better than what Medicare offers. So just based on what we've talked about so far, just this very general overview of Medicare, what are some of the questions about Medicare that you have based on what we've talked about?
Anyone? I had a question in the Q&A that they were asking if a Medigap plan covers eye exams.
If a Medigap plan covers eye exams?
Yes.
It doesn't cover vision exams, standard vision exams. It does cover eye, like macular degeneration or cataracts. It covers medical eye coverage, but not vision.
So what about for a medical reason like diabetes, you have to have an eye exam every year?
You'd need to check on that.
Okay.
Yeah. Some things are and some things aren't. So you have to check on that. And it has to have the right coding.
Oh, yeah.
Yeah. All right. That's a good question a client might bring us, which is our next thing. Will my eye care be covered if I have diabetes and I need vision, if I need vision? They do tend to cover if it's medically, as long as it's medically necessary, most things are covered. So here's what's not covered, just really quick. And I don't want to go too far either because Rosie's going to cover this in A and B. But gastric bypass. Okay, it's authorized for people who are more than 100 pounds overweight and that they have the documentation that's needed to have it approved by Medicare, that they've followed the steps, right? They've gone through the process that you need to be approved for gastric bypass. The gastric bypass is also used for some people with specific digestion issues. They're not 100 pounds overweight, but they have these severe digestive issues, right? Medicare doesn't allow gastric bypass for that reason, even though it's a medical need, because it's considered experimental. So some of those things that they have, and they don't necessarily update their standards as quickly as they might be updated in other venues. So a Medicare Advantage plan, because the company gets to make the decision, if they have a person, and I'm just saying this, I'm not sure that this is correct. I just know that I tried to help a client with this issue, but let's say it's Crohn's disease where they're having problems with their large intestines, right? And that the gastric bypass helps prevent more of having to have their large intestine removed. And it might be that the Medicare Advantage plan would approve that, even though Medicare doesn't. And that's what we see sometimes too. So, okay. Does anyone else have any questions about what we've covered, or some questions that you think clients might bring to you that you'd like to talk about, they'd like to share? Okay.
Wait, I have one. Sorry, Norma.
Okay, Norma, go ahead.
So
thank you for stopping me.
I'm sorry.
No, that's perfect.
I was reading this screen, what, that you think clients might bring to you. So we're going to understand, hopefully, Medicare and Medicaid. Oh, do we need to understand various Advantage plans? What if that client came and said, what if I do Advantage? Will
Yeah.
they cover my gastric bypass?
So the Medicare Plan Finder helps us compare different plans, and it all starts with their drug coverage and whether their medications are covered on that. And there's sometimes you need to understand how Medicare Advantage plans work for sure, to be able to explain the differences that are available to them and understand the options that are presented. But as far as how much would this plan approve for the gastric bypass, or this plan, would they do that? Do you know what I mean? That kind of thing, no. We often send people to the plans for specific answers, and that is absolutely acceptable because we can't know about all the plans. There's 43 plans in Spokane County. I think there's 48 plans in King County. And that's normal, and they change nuances of them each year, and some come in and some leave. And so no, you don't have to know everything about all of them. You just have to know how to talk to them and tell people what to look for, and know when to hold them and know when to send them out. I won't say fold them, but send them out. Okay. That was a great question. Thank you. Scope is a big part of the work that we do. You'll hear us talk about scope, right? It's the scope of your work. It's the boundaries. It's the blinders that we have on, that we don't go any further. We don't talk about anything that's outside of our bubble. My little dog. She doesn't like boundaries. All right. You are going to get a lot of training. This is the first training. And you're going to have the opportunities for a lot of training, and it's all just going to kind of build and come together. But you'll probably, after these 3 days, you'll have a pretty good idea of the original Medicare versus the Medicare Advantage and how they work. We hope. And if you don't, you'll get it in the next step, which is scenario session, is practice and breaking down by section. So, all righty. Should we do a break? We've been here for an hour. Shannon, if I give them a 10-minute break, will 50 minutes be enough for you?
Yes, I sure do hope so.
Yep. All right. Let's do a 10-minute break, and then we'll come back to Shannon talking about eligibility and enrollment.
So we will advise them of other ways that they can do their enrollment. But it's always going to be best to start with online if they can. Okay, let's see if we can complete this chart. If you have a workbook, we're on page 5. There's just a copy of this chart in there. And we're going to try to fill these out. So there are 6 conditions for eligibility into Medicare. And you have to meet one condition on each side, one on the left and one on the right. So who would like to offer one condition on the right or the left side for eligibility for Medicare? What would be one condition?
65-year-old.
65-year-old? Yep.
Yeah.
Yep. Thank you, Alex. Anyone else?
Disabled and receiving SSDI?
Yes, disabled. That's another one.
U.S. citizen.
U.S. citizen, definitely.
Or legal permanent resident.
Yep, you guys are doing great.
It's a railroad worker, something like that, right?
Railroad employees are eligible for Medicare. They just have a whole different set of rules, and I can't think of what they are right now. But they do have another way that they get their Medicare. But maybe Noreen can help if you want clarification, because we don't hear much about that, but they do have their own Medicare system sort of that they use.
Do they need 40 quarters, like Social Security, 40 work quarters?
That is true for premium-free Part A Medicare. They have to have that 40 quarters. If they don't have it, they can still enroll in Medicare, but they probably will have a higher premium. So here is that list. So the first set of conditions are about being a US citizen or a legal permanent resident. So it is a myth that only people who are citizens are enrolled in Medicare. That isn't true. Legal permanent residents or green card holders are also eligible. And then the second set of conditions relate to either being over 65, which is most people, about 85% of people on Medicare are over 65. But there are a substantial number of people in Medicare who are under 65, and they qualify because they are disabled or because they have end-stage renal disease, ESRD, or they're afflicted with ALS. So the point of this is, again, to highlight that the Medicare population is diverse. It's not just citizens. It can be legal residents. It's not just people over 65. It can be younger disabled people. So how about you? The question is, are you eligible for Medicare? And then the tricky part of this question is, when will you be eligible for Medicare? So you may be anticipating that becoming eligible for Medicare at 65, but life can surprise you and you might suddenly become disabled and qualify for that earlier. So that's why that's tricky. So let's practice. We have a client's son coming to you, or a beneficiary's son coming to you saying, my mom is turning 65 in April, and I would like to know if she's going to be eligible for Medicare. So put on your SHIBA volunteer hat, and this is the note that you get. And what would you need to know about this person to be able to determine whether or not they're going to be eligible?
I need to know whether she's a US citizen or if she's a legal permanent resident. And doesn't she have to have lived continuously in this country for 5 years if she's a legal permanent resident?
Yes, you are right. You are right, Polly. All right. So yeah, that would be the first question you would want to ask. Are they a citizen or permanent resident? A lot of people think, okay, I turned 65, so I get Medicare, and that might be the case, but you might need to ask some more questions. So let's take a second and think about what was easy about that question. What was hard about that question? Was there anything unexpected? How did you feel, or how did it feel to do that, to try to answer that question?
If she is a legal permanent resident but just moved here last year, can she be eligible for Medicare after she's been here for 5 years?
I think so. I think I'm going to have to defer to Noreen. Like I said, I'm still learning, so some of these questions can trip me up a little bit, and I never ever want to give the wrong answer.
Yeah.
Yeah. So and we don't want to go into the weeds too much on this, okay, Polly? But I
Okay.
appreciate your asking. It's 5 continuous years. So if someone was here as a legal permanent resident for 3 years and they left and then they came back, their clock would start all over again. So if they're eligible in the other ways, that they're over 65, if they worked here and have work credit for the premium free, right? All of those things still stay in place, but their clock starts over again. So it's 5 continuous years.
Okay.
Thank you.
But that's living here. They can go back and visit, but they just can't move back home and then come back here again. Or something like that. You know, move back to their home country, sorry.
Yeah, thank you.
I had a question about the timing. I know with Social Security, they advise you to you can sign up, I think up to 3 months before you want to collect. But I can't remember with Medicare, because you don't want to, I would assume you don't want to wait until you've already turned 65. So what's the time limit or the time frame that you should be looking at it typically?
Good question. And we are going to cover that thoroughly here in just a couple of minutes.
Okay.
All right. So the point of this exercise was just to get you to kind of be thinking about, you know, there's more to think about. There's always a lot more to think about, and maybe more information that you need. And that can kind of be unexpected sometimes. So, so just think about how it felt to do that and how can you be better prepared next time. And hopefully this training will help you feel better prepared as we go along. So eligibility does not mean that you must enroll on time, because some people can wait. And then for many people, there are consequences about not being on time. So for most of us, becoming eligible for Medicare is a good thing. And it is in general, but for some people, it can actually provoke some anxiety and apprehension, and it can feel very high stakes. Or even that they might be worse off on the other side of becoming eligible or enrolling in Medicare. So it's just important to acknowledge that, and to acknowledge that our work is not to influence people's decisions about whether or not they should enroll, but simply to help them really understand all of their rights and options they have and the implications of moving forward or not with their enrollment. And I'm sorry, I have some, they're working on the road outside. So I don't know if you can hear that. I can certainly hear it. Good, good. Okay.
I'm sorry, can you go back? You mentioned, I have just clarification, maybe I missed it. You said that some people are worse off enrolling in Medicare, or just picking Medicare over maybe Medicare Advantage?
Yeah, well, some people might have that feeling that they might, or fear, that apprehension that they might be worse off on the other side of Medicare if they've been, you know, most of us have had our health insurance covered by our employer and haven't really had to think about it. And so now they're having to make all these decisions and understand this complicated, complex system, and there's no one doing it for them. So that's where SHIBA volunteers become so important to them, is helping them really understand kind of the ins and outs, and help them feel more confident that they can make decisions about how they're getting their Medicare so that it will be the best fit for what they need at that point in their life. That's all it really meant.
Oh, okay.
Yeah.
Washington State, though, is pretty flexible and supportive of consumers, I think, compared to some other states where they can switch between, of many states, it is very consumer oriented, but I can see where that would come in. When you have
Right.
everything taken care for you, it it can be overwhelming when you have to make all the decisions.
Right, right, exactly.
Thank you.
Mm-hmm. All right, so this is a checklist about eligibility and enrollment. So we would say, of course, at first, get informed about all of your rights and your options. Second of all is be prepared to make a decision, whether that's enrolling or waiting. And then be prepared to choose when you want to begin receiving your Medicare entitlement. And here we're talking about Medicare Part A and Medicare Part B, either through the original Medicare system or through Medicare Advantage. And then the next step is to actually get enrolled and know whether or not they need to take action. And the final step, of course, is to pay premiums. So in this program, we're going to, we're going to be focused on pretty simple yet realistic scenarios. We are only looking at a person aging into Medicare, and they're using their initial enrollment period. So we're not going to be talking about people under 65 with disabilities for this particular enrollment discussion, just people that are aging into Medicare because they're 65. And whether or not they want to be in original Medicare, and they will move into Part A, Part B, and Part D. And if they want Medicare Advantage, they will move into one of those plans that include A, B, and D. All right. So this is our enrollment period calendar. So the definition of the initial enrollment period for people turning 65 is the 7-month-long period that surrounds the month of your 65th birthday. So like one of you just commented earlier, you can enroll in Medicare as much as 3 months ahead of time. So 3 months before your birthday month. And your benefits, if you do that, your benefits will start on the first day of the month that you turn 65. And then you can also enroll up to 3 months after your 65th birthday. And then your benefits will start on the first of the month after you've signed up. So here is the distinction of where you can still be on time if you enroll in any of these 7 months. But if you don't do it before your birthday, you could have a delay and potentially a break in coverage, just depending on when for example, your employer's insurance ends. You could have a break in coverage if you wait. So in general, the definition of your initial enrollment period is the 7 months that surrounds your birthday month. Does that make sense? Okay, and we can come back to this slide if you'd like. So we're going to introduce you to some personas that we'll use for the program today and tomorrow. So we first have Carol. She's turning 65 on May 10th. We have Paul turning 65 on April 6th. We have Lupe, will turn 65 on June the 1st. And then we have Jamal, who's turning 65 on September 23rd. So if you do have your binder, you'll find this on page 7 in the workbook of your binder. If you don't, you can pull up you can use the link that Noreen provided to pull up the binder contents and look at this online. But what we're going to do is take each of the 4 personas that we just introduced you to and have you sketch out the Medicare initial enrollment period for each one. So if you do have your workbook, you're going to see some little charts like this. And it's going to show what the birthday month is, and then the 3 months before, the 3 months after. And then we will identify that if the client wants to sign up, they don't want to be late, and they want their benefits to start on time, we want to make sure that we know what their deadlines are for enrolling. So for a person whose birthday month is in April, that's the 4th month, then you have the 3 months before their birthday month, and then they have the 3 months after. So this would be January, February, March, and then April's number 4, and then May, June, July. So January 1 to July 31st is their initial enrollment window. So what we're going to do is take a couple of minutes, and for each persona, we want to sketch out what their 7-month period is. And we want to know what's the date that their initial enrollment period begins, what's the date that their initial enrollment period ends, and what is the date that this person needs to enroll by so they do not have a break in coverage. Let's just say that their coverage is going to end when they turn 65. So we want to know what date the coverage will begin if they wait until the last possible day in their initial enrollment period to enroll. And we'll mark the 7-month period. We'll ask each of you in turn about these bullet points that are on the screen. Does that make sense? So if this person enrolls in January, February, March, their coverage will begin April 1st. If they enroll in April, their coverage will begin on May 1st. If they enroll in May, their coverage will begin on June 1st. So for somebody to not have a break in coverage, if their birthday is in April and their coverage is going to end when they turn 65, when should they sign up so that they will not have a break in coverage? And then if they wait until the very last day of their initial enrollment period, what is the date that their coverage is going to start? Does that make sense? Okay. So I'm going to give you just a couple, like 5 minutes to work on this, and then we'll go over the answers, and I'll take it back to this calendar so you have a reference. So we have Carol on May 10th, we have Paul on April 6th, we have Lupe on June 1st, and Jamal on September 23rd.
Can you go back to the individual names again?
Yes.
Okay, perfect.
Okay, how are y'all doing? You need another minute? Nope. I see a couple head shaking. All right. We can go ahead and finish during our discussion, but who wants to start with Carol?
I can start with Carol. This is Hope.
Thank you, Hope. Okay, so when does, let me move this over to here.
So if her birthday is May 10th, she turned 65 on May 10th, then she has February, March, or April that she can enroll in order to get her coverage to start May 1.
Correct.
If she doesn't do that and she enrolls on, I don't know, May 10th, her birthday, then she won't get covered until June 1st. And subsequently, if she waits until July, and then she waits a little more time, like in June, then it'll be July 1st, and then if she waits till July, it'll be August 1st.
Exactly. So here's a trick question, not a trick question, but a bonus question. If Carol enrolls on the last possible day of her initial enrollment period, when would her coverage begin?
So if she enrolled on March 30th? No, April 30th? Is that the day you
last
mean?
possible day of her initial enrollment window.
August
Be April
31st.
3rd. It would be April 30th.
March
And then she'd be eligible May 1.
No, it
August
would be
31st.
August 31st, that's right.
Yeah, that's the day that her initial enrollment period ends, is August 31st.
Oh, yeah, right.
Yeah. And so then she would still be technically on time in the eyes of Medicare. Now she might have a break in coverage, but her coverage would begin September 1.
Yeah.
But excellent job. Excellent job. How about Paul?
Sorry, I thought you were referring to the last day of her initial 3 months, so
Yeah.
misunderstood.
That's okay. You did a great job. How about Paul? Paul's birthday is April 6th. Don?
Paul would be eligible January 1st. The last day he could possibly sign up without penalty is July 31st. For the no break, it's March 31st.
Excellent. Excellent. And what's the last possible day he could enroll and still be in his initial enrollment period?
July 31st.
Excellent. Excellent. Yay. So Lupe, I'm just going to go through Lupe because Lupe has a little bit of a different situation. When we said earlier, this is the rule, except there's always a special case. This is one of those special cases. So for Lupe, her birthday is on June 1st. So what happens when somebody has a birthday on the 1st of the month is that their whole 7-month window moves back 1 month. So that June 1st birthday is actually counted in the eyes of Medicare as a May birthday. So everything is going to move back 1 month. So that's what happens with people that have first of the month birthdays. And so what that also means, so then her initial enrollment period would start February 1st. So since she's a May birthday, it would be February, March, April. And then technically a May birthday, and then June, July, and August. So the last day she could enroll would be August 31st and still be within her window. Now, if she enrolls during those first 3 months, February, March, or April, her coverage will actually begin on May 1st. So it's going to begin a whole month earlier. And that's just how it works in Medicare land when you have a first of the month birthday. Just got to throw one in there just because. All right.
I
How
knew
about
that because
Jamal?
my birthday is February 1st.
Okay. So you'll be counted by your
was.
birthday. Oh, you were. Okay.
Yes.
I should have just asked you.
I got a free month.
Okay, great. So how about Jamal? Someone, I think you're on mute. I can't see everybody. Who wants to take Jamal?
Can you go back to the page with the names and the dates? Because I can't remember all those names and dates.
Yeah, sorry. Jamal, September 23rd.
Jamal, June 1 is his IEP start date. His IEP end date is 12/31. His enroll before date, no breaking coverage is 8/31. and his enroll before date, no late penalty, is 12/31. And the very last one, if I enroll on the last day on time, it's 1/1 of the next year.
Great, excellent. Thank you.
Thank you, but the answers are on the next page.
I know, that's what I'm looking at too, just so you know. All right, good job, everyone. Appreciate your participation. Let's see, where are we picking up at? So does anyone have any questions? This is probably the main point of this presentation, is so that you understand how that initial enrollment window works. So if you have any questions, now's the time to ask. Okay. Noreen, I think I have 5 minutes left. All right, so the next thing we're going to talk about is whether or not somebody's enrollment is in Medicare is going to be automatic or not. So the standard, the basic answer to this question is, if your client or you are drawing a Social Security retirement benefit before age 65, you will be automatically enrolled into Medicare Part A and Part B. So if you draw your money before age 65, you're going to be automatically enrolled. If you do not, you are going to need to take some action to enroll. If you are automatically enrolled, your Social Security will send you your card and a packet in the mail ahead of time. And your coverage is going to start on the first day of the month that you turn 65. So if you already have been drawing your retirement benefit, you really don't need to do anything. You just need to wait for your card to come in the mail, and your coverage is going to start the first day of your birthday month. This is just a picture of the Medicare red, white, and blue card. This is the number that scammers are always trying to get you to give them. So you want to keep that protected. The number doesn't really mean anything. It's a made up number. It used to be somebody's Social Security number, but they stopped doing that. But if a scammer gets a hold of this Medicare number, they can start billing Medicare using your number, and nobody wants that to happen. So if for a lot of people, enrollment's going to be automatic. Like I said, they get their packet in the mail, their coverage starts on the first day of their birthday month. People take Social Security benefits at all kinds of different times. So some people do it right at 62 or 63. Some people wait till 67 or 70. I guess 67 is full retirement age for SSA. And people do a lot of financial planning, weighing and measuring on when to start their Social Security. So if they're not already receiving their Social Security checks, they're going to need to take action to enroll through Social Security. They're on the website, or by calling the 1-800 number, or by going to their local office. So we have our 4 personas again. Carol started her retirement benefit when she was 63 years old. Is Carol going to be automatically enrolled, or does she need to take action?
She needs to take action.
I think automatic.
Yeah, she's automatic 'cause
Automatic.
she's already getting Social Security.
Right. She will be automatic because she's already drawing her Social Security benefit. Yeah, so she will be automatically enrolled. Paul plans to take his retirement benefit at the same time he retires, and he's already filled out the paperwork online. So was he auto-enrolled, or did he do the correct thing by taking some action already?
He already took action.
Yeah.
Yeah. Yes. So
But
if
if he isn't retiring at 65, what I'm unclear about that.
Yeah, me neither.
okay, okay.
I mean, is he retiring on his birthday?
Well, is he retiring at 65? Because he
Yeah,
may,
his birthday when
Yeah.
he turns 65. Is that, I don't,
Yeah, we're working with we have these rules of engagement in the first part of your notebook. And so we're taking simple but very realistic cases where all of these people are going to stop working at age 65.
Okay.
So that's
okay,
an
so not
Okay.
even if their full retirement age is later.
Yes.
Okay.
All right. So Paul is good. He needed to take action. He's already done it, so he's good. Lupe is not eligible for Social Security retirement because she just has 32 quarters of work credits, not 40. So if she wanted to enroll in Medicare, she could, but she would probably have a premium for her Part A because she doesn't have the 40 work credits. She's just a little bit short.
But she would have to apply. It's not going to happen automatic. She would have to do the work.
Yep. How about Jamal? He's going to wait till 70 to draw his benefit. So does he need to do anything at age 65?
No.
If he wants
Medicare. If he wants Medicare, right.
Yes.
He has to do something.
Yes. Exactly. Yes, he's going to need to take action. So he's going to want to know when he turns 65 when you want to let him know when he would need to take action.
Because it's not clear to me whether or not he's working, if he's employed and if his employer will cover. Sometimes they still want you to draw Social Security and kind of work with that. It's a little more complicated. Is he working?
That would be one question to ask him. Well, are you working? Do you have benefits through your employer?
Yeah.
Yeah.
Okay.
Yeah.
Thank you.
Thank you.
I think one of the things that is that's when I've worked with people, they tend to get Medicare and Social Security are just one product, and they're really two separate products.
Right.
Because I'm on Medicare, but I'm not collecting Social Security. Where my husband is collecting Social Security and he's not on Medicare, so they're not tied together.
Right. Social Security and Medicare used to both be attached to age 65, and Social Security is not any longer. You can collect your Social Security anywhere from 62 or 63 up to, all the way up to age 70. So, but Medicare is still attached to age 65. But that doesn't mean you have to enroll at age 65. It depends on if you have other health insurance coverage or not. Does that make sense?
Shannon, do you mind if I interject for just a moment? Could you go back to the previous slide? So for Jamal, on all of these slides, their rules of engagement were that they want to start A and B when they're turning 65, right? And that was the fact that you don't have to be drawing your Social Security, that you can start Medicare is the point of Jamal. Because many people either wait until they're 60, and Jerry, I'm just going to finish and then I'll let you speak. But many people wait until they're 67. People turning 65 right now, their full retirement age is 67. So they'll go on Medicare when they're 65 because they're retired, but they don't need to collect their Social Security yet, so they'll wait till they're 67, right? And if they have really good income and pension and things like that, they'll wait till 70 because that's when they can get the highest amount of Social Security possible. But they still need their Medicare. And in the meantime, for those people who don't draw their Social Security, they can self-pay. And so just as we go through these, remember that we're talking about people who want their A and B to start when they're turning 65. We're not talking about people who are going to continue working. That's going to come up over and over because you guys are going to want to know, but it's not, we're sorry, it's not part of the rules of engagement. It's not in our boundaries for this training.
Thank you.
It's very real, but we'll get there, we promise, just not in this training. Unless we break the rules for our engagement. Which we probably
might do. I don't know.
Which I probably will at some time.
All right. So, so yeah, this can be tricky for clients because some of them imagine that that Medicare is going to take care of them and they'll tell them exactly what to do because that's what happened with their friend. Carol could tell Jamal, don't worry, on your birthday, they're going to send you a packet with a card. That might be true for Carol, but it's not going to be true for Jamal because he's not on Social Security yet. So they're not interacting with the system in the same way. So that's why, you know, it's never a straight answer. The answer is never the same for everyone. It's always going to depend on their situation. If you are taking Social Security retirement benefits, you can choose to have the premium deducted from your check, and most people decide to do this. If people are not receiving Social Security and they want A and B, like Noreen said, they can pay the premium. So Medicare is going to bill them. And we always advise people to sign up for electronic funds transfer so they don't risk becoming delinquent. And the premium for Part B changes every year. And so it could be they become delinquent because the price went up and they didn't realize it. So we always encourage people to do EFT or have it if they're not already on Social Security, or just have it taken out of their check if they are. And then we always want to screen clients for financial help. So we always, I haven't talked about this. So the Part B premium this year is $185. There are programs, which we'll talk about on Thursday, that can help with this. But the rules can be different about enrollment in the way that the timing works and the penalties work. There are ways for people who missed the initial enrollment window to jump in without a penalty. And that is if somebody is eligible for one of these low income programs that they can enroll at any time. They can enroll at the time that they become, when they're determined eligible for these low income programs. And then if they have incurred penalties because they waited, they can, those penalties can be waived. And then this is just a seed. We're going to talk about this much more later on in the program. But it's just to say the rules are different for different people. And if you qualify for financial assistance, the rules are different for those folks as well. So it can be okay in some cases to wait until later. We call that a special enrollment period as opposed to initial enrollment period. It can be okay, but we need to ask some questions to make sure it is okay. And if they do wait that they know when to jump in. And so we'll cover that in a future program about special enrollment periods. But I'll just say, if somebody is going to work beyond age 65 and they do not want to start their Medicare yet, when they lose that employer coverage, when they turn, when they stop working, that will kick off a special enrollment period, and they'll have a new enrollment window. And we'll talk about that later, but it's just to say that it can be okay. So the question, we'll practice once again with being automatically enrolled. The question of whether you are or not depends on whether you're already getting your Social Security benefit If your client asks you if they'll be automatically enrolled in Medicare when they turn 65, what do you ask them? And then you would ask them, it depends. Are you taking your cash benefit through Social Security already? And if they say yes, you want to make sure that it's been about 4 months, because there's a lag time for for Medicare to catch up with Social Security. So if it's been less than 4 months, they may need to take some action they might not be automatically enrolled.
So does that change our answer for Paul back in the personas? Because he wanted to take his cash benefits at the same time as he signed up for Medicare. Should he?
Yeah, that's a great thing that you pointed out, because Paul, they did say in there that he has already filled out the paperwork online. So he wants to start his Part A and Part B at the same time that he turns 65, but he's still going to be working. So he's not collecting his Social Security benefit yet. So he would need to take action, which he's already done.
Okay, thank you.
Okay, so when we're working with clients, there are things that we need to ask them about themselves and their situation so that we can provide the best counsel about their rules, rights, and options. There are things that we need to tell the client about the system that they're navigating so that they can make fully informed decisions based on their values and preferences. And then we can share with the client the things that will help them promote their own comprehension and help them be organized to take action and be on time. So in general, what we're talking about here are publications and job aids or web resources that we can give them to make sure that they have what they need as a takeaway from the conversations that they're having with us. So when you're in a counseling session, you're asking them questions about their situation, you're telling them or informing them about their rights and options, and then you're sharing with them, hopefully in most cases in writing, where they can go for further help or what their actual next steps are going to be. So how about you? Let's engage the room again and see if you have Medicare right now, and if you do, did you use your initial enrollment period?
I'll go. I'm on Medicare and I did not use the original period. I was on my husband's health insurance through his employer, and he retired last September. So we had the, I forgot what you call it, the delayed period.
Your special enrollment period, yep.
Yeah.
Great. Anyone else want to share?
I'm Hope, and I signed my birthday's in January. I'm 66 actually. But I signed up like in November, I think, prior to my January birthday.
Oh, great. So you were proactive.
Yes, and I wasn't working then, but I did do Cobra for a period of time.
Okay, so that makes sense because Cobra is very expensive.
Yeah.
Yeah. Don, I see your hand up.
Yeah, it's been 10 years, so I can't remember exactly, but I was paying for my own health insurance, which was expensive. So I'm sure I took advantage of the initial enrollment period.
Okay. Yeah. All right, thank you. So just a couple more things to wrap up, and then we can take a break. So I just want to say that we're going to encourage you as a SHIBA volunteer to suggest to your clients that they all create a secure, personalized account on the Social Security website. It helps you with these things that are on the slides. Forecasting your benefit protects against ID theft. You can, well, at the time that this curriculum was written, you could go in and put in a change of address or change your bank account or replace a lost card. I think you can still do most of those things except maybe change your bank account. You might have, they're changing the rules in Social Security about what you have to do. So none of that. So all of that is still a little bit up in the air for now. But these are a list of reasons why it's good to have a Social Security an account. All right, you guys ready for a break? All right, let's do 10 minutes and then we'll come back at 3:30 and wrap up.
Okay, so our learning objectives for today are to gain an understanding of Medicare Part A, which covers services for hospital or inpatient care, as well as skilled nursing facility care, hospice care, and some home health care. One way that I find it helpful to distinguish between Medicare Part A and B, I think Noreen taught me this or taught us this. I'm also new to the Office of the Insurance Commissioner. I started on August 1st. So something that I caught on to or that stuck with me early on was that to think about Part A as standing for admitted, like when someone is admitted into the hospital. So that's helpful for me to remember that Part A. So Medicare Part A is a major medical insurance that covers significant cost for beneficiaries. Most beneficiaries don't have to pay a premium for Part A. However, there are a small number of beneficiaries who do have to pay a premium. But when that does happen, financial assistance may be available to help cover that cost. We'll talk a little bit more about that as we move on through the program. Next, benefits and beneficiary cost sharing depends on whether the beneficiary chooses to stay with original Medicare or go with the Medicare Advantage plan. So what is actually covered and what the beneficiary will end up paying will depend on several factors. So it's not always a standard amount. When it comes to adding to your skills, we hope that you'll be able to define your own out-of-pocket cost for Medicare Part A covered services. And two, to be able to use a job aid to illustrate for a client some of the costs that they may face for Part A services in original Medicare. And I'll share that job aid with you guys. And then also three, help a client determine whether they may have a premium for Part A compared to no premium, and explain to a client how to check their own coverage for Medicare Part A benefits. All right, so now we're going to talk about covered benefits and costs. Like I mentioned a moment ago, Medicare Part A helps pay for inpatient care for hospitals, skilled nursing facilities, hospice care, and home health care. Also, if you are a hospital inpatient and receive blood, Medicare Part A typically covers the cost of the blood the provider gets from a blood bank. Again, most Medicare Part A beneficiaries do not pay a premium because either they or their spouse have a work history where they have paid into it through federal tax deductions from their employment earnings over the course of their work life. So to qualify for premium-free Part A, a person must have at least 40 quarters of work credit, which equates to about 10 years. So that means that in those 10 years, they were paying in Social Security taxes. So individuals who don't meet the 40 quarter threshold will have a premium for Part A. And that amount depends on the number of quarters of work that of work credit that they actually have. So if you look at the chart here, this shows the 2025 monthly premiums for people who have fewer than 40 quarters of work credit. So someone with fewer than 30 quarters would pay a $518 monthly premium, and someone with 30 to 39 quarters would have a $285 monthly premium, and those with 40 or more quarters of work credit don't have a premium or don't pay a premium for Part A. It's also important to note that generally there isn't a penalty for Part A, since most people have premium-free, but a penalty could exist if someone doesn't qualify for premium-free Part A and has to buy it and doesn't do so when they're first eligible for Medicare. This might be one of those, the rule is unless a special condition applies or except when type situations, because the person might still end up getting premium-free Part A if they have a special condition. So, but that's more advanced. But so here is the chart to give you an idea. So it is quite expensive. Any questions so far? All right. Again, I think you've already seen this chart, but this is the Medicare Systems of Care chart. It helps illustrate that both original Medicare and Medicare Advantage include Part A coverage. So regardless which system of care a beneficiary chooses, their plan will include Part A services or benefits. All right, so here, I'm going to show you a great job aid that we have that's available for you as a volunteer to use. I will post the link in the chat in just a moment here. But I want to quickly share with you what you'll see when you open the link. You can see an image of it here on the slide. It's a little more condensed though, so I'm sure you probably can't see it very well. So I'm going to move the PDF one that is from the link on here. Can you see that? Did it move over? Yeah, okay, I think I see Alex nodding yes. Okay, perfect, thanks. So it takes you to this chart, which has a breakdown of covered services and 2025 costs for Part A. So Part A is actually on page 1, and then Part B covered services on page 2, but for this, we'll focus on page 1 here. So you'll see it's broken down by covered services on the left here, followed by what the Part A benefit for that particular covered service is, what Medicare will pay for the service, and then what the beneficiary is responsible for after Medicare pays their portion. And this amount here, so the amount the beneficiary is responsible for would be if that person didn't have any other form of supplemental insurance to help cover the cost. So for example, we'll do an example here, hospitalization. If we look at the first row here, if a beneficiary is hospitalized, the first 60 days are fully covered, except for $1,676, which is actually the deductible that the beneficiary is responsible for. So that is the Part A deductible. So after the $1,676 is paid, deductible is paid, Medicare will then cover all costs for covered services during those first 60 days. If the hospitalization extends between 61 and 90 days, then minus the deductible, Medicare would pay all but $419 per day, which is what the beneficiary is then responsible for. For 91 to 150 days, minus the deductible, Medicare would pay all but $838 a day, which is the beneficiary's responsibility at that point. And should the hospitalization extend beyond 150 days, at that point, Medicare no longer covers anything beyond 150 days. And then all costs would be incurred by the beneficiary. So this is just one example, as you can see here. You can actually also find this chart in your binder for those who have it. It's towards the back. If you want to take a look at that. But as you can see here, the chart illustrates that although Medicare is a great coverage, a beneficiary could still end up having pretty significant out-of-pocket costs, out-of-pocket expenses, excuse me, especially if they don't have any other form of supplemental insurance in addition to Medicare. So again, this is a great tool that you can find on our website. Like I said, I'll post the link in the chat unless someone has beat me to it. But it's available to you. It's a great resource tool that especially, I find it very helpful. So I definitely encourage you to familiarize yourself with this document and have it available. All right, it looks like we have a question from Don.
I hope this isn't getting ahead of us, but on the 91st to 150th day, it mentions 60 reserve days. Is that the first 60 days, or what does that mean exactly?
I think it has to do, well, so there's a cycle, and it's down in the fine print. And if you look at if you have the chart in front of you,
yes.
So a benefit period, it has to do with the benefit period. So it says,
okay.
If you enter a hospital again after 60 days, a new benefit period would begin. So it's referring to that.
Okay, thank you.
Mm-hmm. Anyone else? Right. Page 11 in your workbook has this chart. You can use this as a guide to help you organize your notes when preparing for a counseling session with the client. First, want to take a quick note that it's okay to start with basics, like defining the terms to the client. Some individuals might not be familiar with some of the terms like deductibles, co-insurance, or co-payment. So if you find yourself in a counseling session and you find that it would be helpful to explain these first in terms of the context, in the context of their Medicare benefits, that's perfectly okay. You can also use this chart along with that job aid that I just showed. So the job aid would help you, give you the information that for some of those Part A covered services, and then this chart would help you so that you can make more specific notations pertaining to the client that you're working with. For example, we just went over the benefits for hospital care. So you could use this chart to explain to the client what their out-of-pocket might be, or their deductible, or co-insurance if they don't have any other supplemental insurance, or what their costs might look like for hospice care or skilled nursing care, and so on and so forth. Helpful aid that you'll find in your binder. All right, so in just a moment, we're going to go over the kinds of questions that you might have about Medicare Part A. But first, we'll take a second to reflect on some things that you might already know about it, about their covered costs and services, either based on your own personal experiences or from information that has been covered so far. We know that Medicare Part A covered services include hospitalization. You might hear some people refer to it as hospital insurance, as well as some inpatient care and services like hospice care or blood services. We also learned that in general, most individuals have premium-free Part A based on having a minimum of 40 quarters of work credit, as well as the portion of costs for covered services under Medicare Part A that a beneficiary may end up paying, including deductibles, co-insurances, and co-payment. So I'll give you a moment here just to collect your thoughts, and then we'll share as a group. All right, so based either on your own experience or from what you've learned today, what are some things that you know about Medicare Part A? Is there anything that you'd like to know? You're welcome to share with the group, as well as jot down questions on page 12 of your binder, or on a notepad if you don't happen to have yours yet. If you do jot them down, you can share those with the group, or it's also helpful to have so that you can refer back to as you continue to progress in your onboarding session. And soon many of you will be on your mentoring journey as well. So any thoughts on this? Anything interesting, anything new, anything that maybe is different than what you thought?
Well, I have a question. If Carol comes to me and she says she's turning 65 in April, and she's never worked outside of the home, but she got divorced 2 years ago. So she herself does not have any work credit hours, and she's not currently employed. Can she still use the work history credits from her former spouse?
Good question, Polly. So yes, if you are a spouse or an ex-spouse, they may qualify, yes. If the ex-spouse had at least 40 quarters of work credit for about 10 years. So if they were eligible for premium free, then that individual, the ex-spouse may be eligible as well.
Thank you.
Anyone else? That's kind of a question that you might get from a client as well. So kind of similar to the exercise that we did in the other sections as well. Some questions that you anticipate clients might bring to the table as they discuss their Part A. I'm sorry, did I interrupt someone?
Well, this is Hope, and I was just going to piggyback on what I think Polly was just talking about. And doesn't her scenario, if they've been divorced shorter than 10 years, isn't there a time period where if their divorce is longer than 10 years, then they cannot access?
I think it have to be. I thought it was.
Noreen's shaking her head, so I guess I'm wrong.
Yeah, I thought it was the opposite, because I remember when I heard about it, it reminded me of the military and the TRICARE, having been married a minimum of 10 years. I think it's 10 years, but Noreen will have better insight on that.
Yeah, you have to be married for 10 years, but it doesn't matter how long you're divorced, as long as you haven't remarried. Or before age 60. If you remarried before age 60, if you remarry after age 60, it's a little different too.
Great question. All right, so I will keep us moving here. Thanks so much. All right, so are there any other questions? I know we just started talking about those that you think clients might bring to you as a SHIBA advisor. You're welcome to share or continue to jot those down in your counseling chart there on page 12. Sometimes it's helpful to have questions ahead of time, ahead of counseling sessions. That way you kind of, it helps you navigate the session. Sometimes it can help with logistical concerns or just gaining more understanding about the services that are covered and just ensuring that all options are shared and that appropriate care is received in different settings and the different scenarios there.
This is Sharon. I think people are very confused about Advantage plans versus original Medicare. And because all the TV commercials always talk about Advantage plans, I think some people aren't even aware of original Medicare anymore. So I think a lot of the questions are in the beginning revolve around that.
Wonderful. Thank you so much.
I had a question when we were talking about what Part A covers. It occurred to me to wonder if my supplement Plan G would cover the part of Part A that, like the deductible and the extra $419 a day and whatnot. I just looked up a chart and it does cover all that. So that I was able to answer my own question. So just for information.
Fantastic. I like it. I like the question and the answer. Great. I'm glad you were able to find it so quickly. I think it sounds like you found it pretty quickly.
Yeah, I've got another computer next to me, so.
Great, great.
Well, I kind of learned interesting thing about hospitalization. I thought everything will be, I have to pay everything from Part C, but it looks like Part A is also will cover some of the costs. So I didn't know that. Thank you for teaching me that.
No problem. Thank you for being here. All right. We have about 10 minutes, but I think we have time to do this activity. We like to incorporate an activity in each session. So for this activity, I would love to have 2 volunteers. One individual who maybe has a question that they think that they might expect from a client, and then another volunteer who might like to try or practice answering the question. Or we can all work on it together as a group. But if I have 2 volunteers, that would be great. And we've had some great questions so far. Or we can wrap up and then just in general questions, Q&A before we wrap up for part or day 1. Do I have any volunteers before I?
I'm Rosie. I was away for a minute, but there's an answer in the Q. There's a question in the Q&A. I'm not sure if you got to it. Does Part A cover hospice care and/or skilled nursing care?
Yeah, I actually can't access the Q&A, but I'm sorry. What was the question?
Jerry asked, does Part A cover hospice care and/or skilled nursing care?
So if you go to the chart that I showed, yes, we can take a look at that. Skilled nursing care, so it is broken up into separate days. So the first 20 days, up to 80 days, and then beyond 100 days, and then hospice care. The benefit is as long as the doctor certifies the need. So does that answer the question, or? Let's see. All right, so just want to take a second to acknowledge this was a shorter section, but that we know that this is a lot of information coming to you at once, but although you all are doing fantastic, but please don't forget that you can count on your support team throughout your entire journey as a SHIBA volunteer. There are other volunteers in your group, as well as your volunteer coordinator, your regional training consultant, your SHIBA team here at the Office of the Insurance Commissioner, and of course the network of professional colleagues that you'll grow over your time as in your work as a volunteer counselor. So it's definitely challenging work, but again, there's lots of support from various sources, and that will help you feel more confident and more comfortable as you grow in your skills as a SHIBA counselor. So thank you all so much. You've been fantastic. And this concludes my portion of Medicare Part A. I believe tomorrow we'll start off with Part B. Yeah, that's all I have for you. Kick it back to Noreen.
Sure. Does anyone have any questions about anything that we covered today? Do you have any questions about the enrollment periods or anything that we covered?
This is Jim. So I remember when I turned 65, getting bombarded by mail every day.
Yeah.
Right.
Yeah.
So I can imagine someone coming in and say, what's all this about? And how do what's the best one to choose? I mean,
Mm-hmm. And that's exactly what we do, what we help people with a lot. During open enrollment, it's primarily drug plan reviews for the next year, right? But the rest of the year, much of the work that we do is helping people who are new to Medicare understand their options and what is the best path given their preferences and their needs. What's the best path for them based on their needs and preferences and situation and things like that. A lot of times I'll tell people when I'm talking to them before an appointment like that, just go ahead and just use that for firewood kindling. Just make little fire starting logs out of all of those ads and things like you, because you're not going to need any of those. They're just good for other purposes at this point. Yeah, it's overwhelming. People are overwhelmed, and that's why one of the reasons our service is so valuable. And what you're doing as volunteers is just incredibly valued and appreciated because of that. Anyone else? Well, and Linda's back, so she could be doing this. I'll hand it over to Linda. What is that called? Our mistress of ceremonies. Or our master of ceremonies.
Yeah, I made it back. So it looks like you guys get to start off with me tomorrow. We'll do Part B. And so if you have any questions, anything left today, we have a couple minutes. If not, if you think of things tonight, write them down and we'll address them tomorrow. I'm hoping everything went well today. That's kind of what I got, guys. I guess I can let you go. I wasn't expecting to wrap it up like this, so but thanks for being here.
Her hand up.
Oh, did you have a question?
I think it was a clap reaction.
Clap?
Like thank
Yeah,
you.
it's not doing this.
Yeah, there was there was clap.
So anyway, so I look forward to it. I'll see you all tomorrow. Thank you so much for coming.
Have a great night, everyone.
Thank you.
Thanks,
Yes,
Tom. See you tomorrow.
Thank you, everyone.
Thank you.
See you tomorrow.
Right.
What
my
a
way.
nice group.
Yeah.
What a nice group. You guys did really, really well. Is it starting to feel like it's flowing a little easier?
No. Did did it feel like I feel like I'm like, did I skip a bunch? Because I'm like, I got done awfully fast, which is good because I finished on time, but I was like, did I hide a bunch of slides or what? Because I was like, before I knew it, I was like, oh, well, wrapping it up. I feel like I gave you 3 pieces of information, but here, hope you learned a lot.
I think it's because well, I think it was last month. Was it last month or the month before? You had 100 billion questions.
Yeah.
It was the Rosie show for an hour, and most of that was just them peppering you with questions. And so I think this time, I don't know, it's, every audience is different, but I thought it went really well.
I like this group a lot.
Mm-hmm. Yeah, I do too. So the deal with the list, I don't know if you saw my chat. Some people didn't get the link to take the privacy and confidentiality training because Amy could not assign it to them because she did not have the permissions. And Tim thought he reset the permissions and he did not. So that's why everything was late. But they signed that initial privacy document when they submit their application. So it's a non-issue in terms of them being here and recording it to use it, which, by the way, if you're still recording, we could stop it.
Did you stop it already, Noreen? No.